My name is Miles Howard. I'm a obstetrician and gynecologist, board certified in obstetrics and gynecology. When I was in medical school, I initially went into the medical field to become a pediatrician. But when I did my obstetrical rotation, I was just fascinated in the birthing process. And when I delivered my first patient, I just thought it was a feeling that I couldn't describe. So in my practice, I like to pride myself that I can really see any type of obstetrical or gynecologic patient or any patient that is seeking women's health care. I take care of young patients in their early teens to patients in their 20s, all the way into their menopausal years. And so I really feel that I'm able to provide care in all phases of the female life. In the obstetrical area, I do feel I do have a fairly good training in high-risk obstetrics, but I do also low risk or just normal care. In the gynecologic area, I do feel I have quite a bit of surgical experience, from laparoscopic surgery to robotic surgery. I can also do a lot of the vaginal procedures, urogynecologic procedures. So I do feel that I'm trained in all those areas from the gynecologic side. And then I do have a high interest in the hormone replacement therapy for the menopausal patient. In the obstetrical realm, I really do pride myself on vaginal deliveries, but obviously there are times that cesarean sections are necessary. I do feel I'm good in complicated labor management. As far as instrumental deliveries are necessary, I'm trained in all those phases of deliveries. In the gynecologic area, I do a lot of robotic surgery. A majority of my cases are completed with laparoscopy. I do try to avoid laparotomies, but when necessary, I'm able to perform that type of surgery. Well, I do take a lot of pride in the quality of care that I provide. I do have a high level of pride in how I approach patients. I really do want them to know that I care about them and that I care about outcomes. I try to really keep a low complication rate, although in medicine sometimes it does happen, but it's more about being able to recognize that and take care of that complication. If there's any one area that I really focus on, is just trying to be, somebody that they know they can trust and depend on. The way I usually approach patients is when we're discussing whether it be obstetrical or gynecologic issues, I always want them to be involved in the decision-making. I really do try to provide informed consent. I think it's very important that patients understand what either obstetrically or gynecologically is going on, either with them, the baby, or their problems that they're undergoing. And that when I make recommendations, it's sometimes difficult when they want me to make the decision for them. And I really do want them to be involved in the decision making, because at the end of the day, they're the individual that has to accept what is decided on and then how the outcome is going to be. So if I involve them, then at least they know that they took a big part in that whole care management situation.